Big story. Governor Mike Parson says Medicaid will officially not expand to thousands of Missourians this summer. Our Chief Capitol Bureau reporter Emily Manley sat down with the governor one-on-one today to find out what's next.
Voters approved the measure in August to expand Medicaid to anyone making less than $18,000 a year. Lawmakers chose not to fund it, which is why Governor Mike Parson tells me the state doesn't have a choice, and he's content that there will be lawsuits.
So there's really no mechanism to move forward at this time. I'm satisfied it'll end up in the courts.
Governor Mike Parson says the state formally withdrew the state's application Thursday to expand Medicaid in July.
Once the legislators didn't fund it, I don't think there was a lot of choices left.
Last week, lawmakers sent a $35 billion budget to the governor's desk without money for the voter-approved measure.
The legislators did what they thought was right. Whether we agree with it or not, that's how they're set up. This is how democracy's set up, and they chose not to fund it.
Expansion was expected to cost $1.9 billion, with less than $130 million coming from the state.
People are probably going to have a hard time understanding that. It says, wait a minute, I voted for it, and you said that you would fund it, but all of a sudden now you're not going to fund it.
It's a shame. It's disappointing that the governor made this decision.
The Missouri Hospital Association says it was not prepared for the governor's decision.
We have assumed because of his statements and the actions prior, which have been in line with implementing the measure as adopted by voters.
Dave Dillon with MHA says 10 rural hospitals have closed in the last decade, and Medicaid expansion would have prevented adding more to that list.
We certainly will work with the other stakeholders to ensure that to the extent we can, that voters will be upheld.
While those with insurance could now foot the bill.
When we do not get paid for individuals who come and seek uncompensated care, there's only a limited number of things we can do. And one of those is to shift the cost to people who have health insurance.
Now, Dillon says in 2019, hospitals in Missouri totaled around $1.5 billion in uncompensated care. Parson told me that if the courts decide that the state has to expand Medicaid and fund it, they will follow the law. Reporting for our Missouri Capitol Bureau, I'm Emily Manley.